Hello students, Assalamu alaikum. How are you? Today we are going to study humerus. Humerus is a bone of arm or brachium. So it is a type of long bone. So like every long bone, it has got two ends, upper end, lower end, and shaft. Or in other words, diaphysis, epiphysis, and metaphysis. So first of all, we are going to discuss about the head of the humerus. So as you can see, head of the humerus is in its major parts, it's rounded or spherical shaped here. So this spherical shape head of the humerus is basically covered by means of a hyaline cartilage because it is going to articulate with the glenoid process of the scapula. Here comes the glenoid process. So it is going to articulate with the glenoid process. So head is bit larger as compared to glenoid cavity. So as we have discussed already in the previous video on scapula, these margins of the glenoid cavity, they are further augmented by fibrocartilage, which is glenoid labrum, and it deepens the glenoid cavity further so that most of the head could be accommodated within that glenoid cavity. So this is head, which is rounded or spherical, covered with hyaline cartilage. Now here you can see this constricted neck portion, this constricted neck here. It is present circumferentially all around the head. It is a rim-like structure, which is here. It is broken. It is artifact. Don't go for it. This constricted neck, this constricted portion of the neck, which is circumferential all around the head, it is actually called anatomical neck of the humerus. So this anatomical neck is important because the capsule of the shoulder joint, which is glenohumeral ligament, it gets attached over here. And this anatomical neck, or this constricted portion, it separates the rounded head from rest of the upper end of the humerus. So here we have got two tubercles. This is lesser tubercle. If we hold this bone in anatomical position like this, so it's going to face anteriorly. This small portion, which is lesser tubercle, it's going to face anteriorly, whereas this larger one or greater tubercle, it is laterally. So lesser tubercle and greater tubercle, and between these two tubercles we have a groove-like structure or sulcus, which is called intertubercular groove or sulcus, which means a sulcus which is present between the two tubercles, and those are lesser and greater tubercles. Other name for this groove is bicipital groove of humerus, because the long head of the bicep tendon, it passes through this groove. With that reference, it is also called the bicipital groove of humerus. So this groove actually has got two lips. This one here we see is medial lip, and here we have got lateral lip, and between these two lips, this is the floor of the groove of the humerus. So inferiorly here we have got the constricted part. Again, this is this particular portion which I have shown you can see black line. This is called surgical neck of the humerus. This is called surgical neck. It is all around. This surgical neck of humerus is in intimate relationship with the axillary nerve. So most of the times humerus gets fractured over here. So we have to perform a surgery in order to fix that fracture. So that's why this particular area is called surgical neck. Now we come to the shaft. Shaft is a bit rounded in its upper portion, whereas it is triangular in cross section in its lower part. So this shaft in its upper part is on the lateral side here in its upper part, and on lateral side here we have got a V-shaped structure, V-shaped tuberosity, which is called deltoid tuberosity. Deltoid muscles get attached over here, and just behind the deltoid tuberosity here we have a very faint or subtle or very you have to feel it. There is a groove which is called spiral groove, because the direction of this groove is spiral. from posterior axillary nerve along with profunda brachii artery. It passes through spiral groove from posterior aspect of the arm. It comes bit anteriorly, so this is called the spiral groove. It is very faint. It cannot. This groove is not like the groove of the bicipital groove of the humerus. Rather, it is very faint groove. So this is called spiral groove. In the lower part, shaft, it has got, as I told you, it is triangular in cross section. So here comes the anterior border. Anterior border, it is sharp one. Then we have got the medial border of the lower shaft, and then we have got the, sorry, this one is the medial border, this one is the lateral border, and this is the anterior border. So between the anterior border and medial border, here we have got anterior-medial surface of the humerus, because it is facing anteriorly and medially, and here comes between the anterior and lateral border, here we have got anterior lateral surface. So again, this particular sharp border is anterior border, this is medial border, this is lateral border. Here comes the anterior lateral surface, medial surface, and here comes the anterior lateral surface. So inferior part of the humerus, here we can see that it is bit complicated, but not that complicated. Here you can see it is expanded from side to side, and here we have two structures. Look at the shape of these two structures. Look at this rounded one, this is capitulum. The word capitulum is derived from the capitus. Capitus means head, small head, like you say, for example, Islamabad is the capital of the country. It means that it is the head of a country. Any capital of any country in the world is basically head of that country. So this word capitus is derived from the word head. So here you look at this structure, it is small head like rounded structure. So this is capitulum. So if you remember anything with reference to the origin of the root word, it will always help you in remembering that what structure is what. For example, this rounded head-like structure is a capitulum, whereas you look at this structure, it is a pulley shape like a pulley shape. So this pulley-like structure is called trochlea. The word trochlea means pulley. So whenever someone asks you which is trochlea, which is capitulum, you must remember the meanings of those words, and you will never forget which one of these is capitulum and which one of these is trochlea. So here we have one fossa just above the trochlea and one fossa just above the capitulum, and one fossa behind the lower end of the humerus. Here this fossa is basically radial fossa, and here this fossa is coronoid fossa, and on the posterior aspect here we have olecranon fossa. In a while I will tell you why these fossas have such names, but before that I want to finish this lower end of the humerus. And these five structures, coronoid fossa, radial fossa, trochlea, capitulum, and olecranon fossa, these are all called combined, they are called condyles of the humerus. So these are condyles, and here comes the epicondyle, medial epicondyle, and likewise here we have lateral epicondyle. As you can see that lateral epicondyle is not as prominent as medial epicondyle. Medial epicondyle is very much prominent as compared to the lateral one. And just behind the medial epicondyle we have ulnar nerve. Many of you must have experienced a sudden current like situation in flowing down your arm when your medial side of your elbow hit some hard surface. It is actually depolarization of the ulnar nerve. So with reference to that condition, sometimes this bone is also called funny bone. So here we have got medial supracondylar ridge, which is projecting upward from the medial epicondyle, and here is lateral supracondylar ridge. So as I told you, I will let you know why these are called radial fossa, why this is called coronoid fossa. So look at the shape of this structure. This is rounded structure. So if it is going to make a joint, the reciprocal bone, the other bone must have a reciprocal surface. For example, it is going to articulate with the head of the radius. And now you look, this is the head of the radius. You look at it, it is a disc-shaped structure. And superior surface of this head-like structure is concave, so that it can articulate with the rounded convex capitulum. So concave, convex, concave, convex. So when you flex your elbow, fully flex your elbow like this, when fully flex your elbow, this disc-like head of the radius is going to be accommodated here, which is of depression. It is going to be accommodated here like this. So that's why this is the reason this is called radial fossa, because it accommodates the rounded head of the radius. Whereas this is trochlear, this is ulna, and here we have trochlear notch of the ulna. Why trochlear notch? Because it is going to articulate with the trochlea of the humerus. So that is why this notch is called trochlear notch. And this trochlear notch has got two important parts. This is this portion, this particular portion here, it is called olecranon process, and here this process is called coronoid process, olecranon process. So when trochlea articulates with the trochlear notch, and when you fully flex your forearm, so this coronoid process, it gets accommodated in this coronoid fossa, like the way radial head used to get accommodated in the radial fossa. Likewise, coronoid process going to accommodate it into the coronoid fossa, this coronoid fossa. So this is the reason this is called radial fossa, and this fossa is called coronoid fossa. On the back, there was a olecranon process. So when you fully extend and straighten your arm, this olecranon process, this hook-like olecranon process, it gets accommodated into this particular depression or fossa, which is called olecranon fossa. So olecranon head gets accommodated into the olecranon fossa, and radial head gets accommodated into the radial fossa during flexion, and then coronoid process gets accommodated into the coronoid fossa during flexion. So whereas olecranon process gets accommodated into the olecranon fossa during full extension. These two movements were in full flexion, they were accommodated, and whereas olecranon process is going to accommodate into the olecranon fossa during full extension. So this video was about the general features of this humerus, and I forgot to mention here we have got 3 impressions onto the greater tubercle for stitch muscles. This here we have got superior most impression, then we have got middle impression, then we have got inferior most impression. These are for the rotator cuff muscles, which I would be discussing in next video about the attachments of the humerus bone. Thank you very much.